back with Dr. Zymantas. Dr. Zymantas, so we talked about missing teeth. And that they should be fixed for two major reasons. Not looking elder than one is, sometimes by many years, and maybe not having headaches and other tensions in the neck and in the shoulder and stuff like that. Now, what are some of the major ways of replacing teeth? Because there's a lot out, technology has advanced, and some are more expensive than others. Are they expensive and new ways only a rip-off, or are they really better than the old ways? What's the deal there?
There's probably three main ways of replacing a tooth. Say, let's talk about right now like a single missing tooth, and primarily there are three different ways. Previously, the most common one was using a removable type of a device called a removable partial that clips onto your teeth like a paper clip, kind of contacting on the remaining teeth that grips the remaining teeth, and with a kind of a dummy tooth to replace the missing tooth that was to be replaced. Another form is called a bridge, where you grind down the tooth in front and a tooth in back of the space, and a prosthesis, a 3-unit, kind of like a miniature bridge, you can imagine, is cemented over the remaining teeth. And there are sometimes troubles with that because of cleansability issues, or potentially the teeth may need root canals. But because of the advances in technology, today we have probably the best way to replace it. Not always in the best way, but in most cases these days, the best way to replace a missing tooth is using an implant, which is a titanium screw that gets placed into the bone, and a tooth restoration is placed on top after, sometimes immediately, and other times the bone has to grow into the implant, called integration, for approximately 4 months, and then the prosthesis or the tooth can be placed on top. And that's the ideal from a functional standpoint and a clinical standpoint. You also preserve the bone. If you have an implant placed in the jawbone, the bone will not resorb, will cease resorbing, and there's sort of like a more or less the bone has a reason to live because of the implant, and it sticks around. Otherwise, the bone resorbs away and dissolves away and causes all kinds of bad issues in the future.
I see. So what you're saying is that if we do a bridge, even though that is of course a lot better than having no bridge, because the teeth will be prevented from shifting, I guess, right?
Correct. Yes.
But it doesn't replace the tooth which is missing, where you put that metal stick in it, and thus the bones, if you have too many of them, bridges and tooth missing, the bone still could possibly be shrinking, and you still could be looking a little older after a while. Is that a little bit what you're saying?
This is correct. The bone can, in the areas where the teeth are missing, the bone can shrink away, and it can lead to sometimes facial disfigurement. Not all the time, but on occasion it can. And but there are again issues with the potentially needing root canals, or the potentially having other issues with the tooth,
such as a gum disease, because where there is the bridge and the three teeth together, you cannot really floss there very well. And most of us, I don't know about other people, I shouldn't speak for most of us, but many of us have problem flossing as much as we should. So if there's a difficulty to go through and you need one of those needle flosses, chances are that people do it less, and then they develop sometimes gum disease in that area, right?
That is correct. That's one of the common reasons for bridges to fail, is because of periodontal disease issues around the teeth from not being able to properly clean after having a bridge placed.
And if that happens, I mean, you mentioned in some other videos about the danger of gum disease, and people can go to those videos, but that is, of course, never mind that it is expensive to replace it, and by doing so probably exceeds the money of what the implant costs more in the first place. But at the same token, having a gum disease can have all kinds of other problems, such as kidney, heart, liver, blood disease, lowered immune system in general, and that's the real danger of gum disease, right?
Correct. The new research has shown that there are factors from the infection around the gums of the teeth, the periodontal disease. You end up ultimately creating what's called C-reactive proteins, which have been found to be very dangerous to the entire system of your body. Cancers, Alzheimer's disease, diabetes, the list goes on and on. Immunological problems where your immune system is compromised, especially now we're approaching the flu season. If you have periodontal disease and you're not properly taking care of your teeth, then your immune system is going to be compromised, and you have a greater chance of requiring possibly hospitalization. But you may have a greater chance of developing a flu if you have a compromised immune system, and if you have periodontal disease, you certainly do have a compromised bodily immune system.
I got that. So basically, the slightly higher cost of an implant versus a 3-unit bridge, it gets even out with this type of problems. And let me ask you, does an implant last longer than a bridge in terms of how long it lasts? The studies show the success rates are, depending on, there's many different kind of implant systems, and roughly the success rates are about 95%. So the success rates are very, very good in relation to 3-unit bridges. The success rates of a 3-unit bridge is not as good as a conventional implant today. Got it. But in terms of lasting till it breaks, till it has to be replaced, does an implant last longer than a 3-unit bridge?
If an implant has a sufficient amount of bone surrounding it, an implant may last a lifetime. It all has to do with having a proper balanced bite and having a healthy oral environment, and the patient has to be hygienically motivated to keep things clean, which they should be with their own natural teeth, but this is their last chance with an implant, so they should be having a higher level of hygiene to maintain very good oral hygiene.
And of course the same with the bridge.
Yes, the bridge also.
Well, all right. So thanks a lot. I guess you gave us a pretty clear picture, and we'll speak to you more on other topics. Bye-bye.
Okay, goodbye.